Welcome back to Daytime, everyone. Cardiovascular disease kills more Americans than all cancers combined.
It's time for all of us to become empowered to take control of our heart health.
An easy step is knowing which foods we should be eating to help reduce the risk of heart disease.
Dr. Mateo Dayo is here to tell us more. Hi, Dr. Dayo. Good to have you here.
Thank you. You're a vascular surgeon.
Cardiovascular surgeon, yes.
So you absolutely should know what you're talking about.
Correct. That's what they say.
And you've brought a lot of colorful foods, and I keep hearing that over and over again. If it's pretty much a colorful food, it's going to be good for you.
That's generally true, especially when it comes to fruits and vegetables.
What's more important, diet or exercise?
Both.
Okay. You put them on equal footing?
Put them on equal footing. It's certainly as important as what I do every day, which is heart surgery. What I do is only 50% of the story, and taking care of yourself is the more important half.
Okay,
we've got
an
our
apple
fruits
a day
and vegetables.
really will keep the cardiovascular surgeon away?
Ideally. But yes, fruits and vegetables. And what we're talking about here today is really categories of foods. Fruits and vegetables are certainly the most important. You need about 5 servings a day. The reason is because it provides a lot of fiber in the diet.
When you say 5 servings, you're not saying I have to eat 5 apples, are you?
5 servings is, when it comes to the leafy vegetables, about a half a cup to a cup and a half a day, a half a cup to a cup a day. And yes, 1 apple, 1 banana,
And that's
celery.
That's a 5 serving is 1 apple?
1 apple is 1 serving.
So I do need to eat 5 apples a day.
You need to eat 5
what?
apples.
5 apples.
I can't do that, Dr.
Or 1
Dayo.
apple, one vegetable.
You can eat 1 vegetable, 1 apple.
All right.
1 banana.
And as Dave alluded to earlier, the darker colored vegetables are probably richer in vitamins and minerals. When we talk here about bananas, you were talking earlier about checking your blood pressure last night.
Yes.
Potassium in bananas and sweet potatoes, very important in terms of maintaining a healthy blood pressure.
Oh, really? And I don't eat bananas very often.
It's very good for you.
Unless
Plus,
they're in a
tasty.
sundae. But on their own, honestly,
Unless it's a banana split,
I
right?
honestly can't eat a banana on its own.
I'm not a big banana fan, but you know, Nancy eats at least 1 a day,
Well, that's
every
why
single day.
she's got a heart that's very healthy.
I guess so.
And I love the sweet potato. Now, you've got the egg whites here.
Right. This is the second category of food. And when we're talking about the second and third categories, you know, you should probably eat less of those than the other categories. When we're talking about dairy, you know, choose your low-fat or skim alternatives. Eggs themselves, 55 of the 70 calories in eggs come from the yolk. So it's important to eat egg beaters or egg whites, or to, you know, combine them like you were talking
And the
about.
cholesterol is in the yolk as well, correct?
The cholesterol is in the yolk as well.
What if you eat a particular brand of egg that says it's better for you and won't hurt your cholesterol?
You know, hard to do unless they change the chicken.
Oh, it has nothing to do with what the chicken ate either, right?
It can have something to do with what the chicken ate. That's, you know, people who argue for whole foods, free-range chicken, these chickens are eating more natural substances and hence more natural
so they
for
could
you.
be
Okay, so it
laying
could be
healthier
beneficial.
eggs?
Correct.
Okay.
You've got the grill there.
That doesn't
The
look
grill,
real tasty.
Right. The grill, well, we're talking about meats here, and about 2 servings a day. We would prefer that patients or Americans eat fish or poultry.
Okay.
And grilling or baking, it's a better alternative than frying.
Always.
All the time.
Pasta.
Ah, yes, pasta.
Big part of the American diet.
Big part of the American diet that's also been adulterated when we talk about foods. When you talk about bread, you know, you really need to stay away from anything that's white. So whole grain breads, whole grain pastas, brown rice. These are the alternatives when you talk about whole grains, and about 4 to 5 servings a day.
And when you see a bag of bread at the grocery store and it just says wheat bread, that's not whole wheat necessarily.
It has to say 100% whole grain or whole, you know.
But for the whole word.
The whole, correct.
And finally, we've got 30 seconds.
Fats, there are some healthy fats: olive oil, canola oil, sunflower oil, the unprocessed vegetable oils. Use them in moderation again as well.
Okay, and the sprays really do help cut back. I notice when I'm cooking,
correct,
we use a lot of the spray
yes, it
oils.
can cut back in calories, and you can also have olive oil or other healthy alternatives when it comes to oils.
All right, stay away from the creamy, go with the clearish.
Exactly.
Dr. Mateo Dayo. Thank you.
I love saying that name. Thank you very, very much.
You're very welcome.
Still ahead, how to train your dragon. That's right, Sam takes a look at one of the stars, Craig Ferguson.
We'll be right back.